Hello. I'm back again to talk about and continuation of asthma. I'm going to do probably 3 or 4 more videos about the asthma depending upon the topic. So we started talking about asthma last time. To refresh the memory, asthma was thought to be a fully reversible airway obstruction, which means when you have an attack, you have a bronchospasm or narrowing of the bronchial tubes, which causes wheezing, whistling sounds, cough, expectoration, shortness of breath, and that is asthma attack. When you're fine, then everything goes away back to normal. That was the original concept. However, slowly people realized that that is not the whole truth, and there was an accompanying inflammation associated with it. So, the main goal of treating asthma became treating the inflammation. And then people started thinking about what causes the inflammation and if we can stop right there. So, some of the treatments are like locking your door so that a thief could not come and rob your house. So, one way of looking at it is after the theft has occurred, you try to recover the lost items, money, jewelry, whatever, and recover and go back to your original status. The other way is to prevent. So, some of the newer treatments address what causes asthma, and we will talk about that in the future videos. But basic treatment of asthma consists of using a drug to reduce the inflammation. And as everybody knows, steroids are anti-inflammatory. So the mainstay of therapy was anti-inflammatory agent in a steroid form. Now everybody also knows that taking steroids in a pill form or taking any other way than inhaled form is not very good because steroids have bad side effects. So the inhaled corticosteroids in an inhaler were developed. Many years ago when they did the study using only drugs that opened up the bronchial tube, they found out that they were associated with more mortality. So essentially, the mortality was associated with bronchodilator use because the drugs opened up the bronchial tubes but did not address the basic mechanism, which is inflammation. So when the study came out, originally people thought that the use of bronchodilators was bad. The use of bronchodilators is not bad, but excessive use is bad because you're not addressing the basic thing. Also, those people who use more of bronchodilator inhalers, like your albuterol, Ventolin, Proventil, or ProAir, which are the brand names, we are talking about more severity. Nobody uses these drugs for kicks. So when somebody needed the drug 4 or 5 times a day, they were sicker than those who needed twice a week. So naturally, sicker people had more complication, more emergency room visits, and more mortality, morbidity. So it was not a surprise that use of bronchodilators alone was associated with increased mortality and morbidity. So the inhaled corticosteroids, the steroids which are in an inhaler, were started being used. These inhalers then were combined with long-acting bronchodilators, something which opens the bronchial tube, and that became the mainstay of therapy for several years. So various corticosteroids were used, and long-acting bronchodilators were also used of different kinds. Different drug companies came out with different combination. To give you some names which are familiar, Advair was the original one of the oldest drug which has lost its patent and now is available as generic, Advair. It came in 3 different strengths, and depending upon the severity of the disease, we used different dose. The next one that came in the market was Symbicort, Symbicort, CORT. Symbicort again had a combination of inhaled corticosteroids and bronchodilators. It came in two different strengths. And again, depending upon the severity, higher or lower strength was used. Dulera came in market third. And since then, we have Breo, BREO, which is made by the same company that makes Advair. And it comes in two different strengths, 100 and 200. And depending upon severity, we use it. So we currently have Advair, Symbicort, Dulera, and Breo as 4 drugs which are combination of inhaled corticosteroids and bronchodilators in a long-acting form. These drugs are still mainstay of the therapy. There are other drugs which are used, and I'll talk about them later on. But just to understand basic thing, the drug combination is effective in many patients. In severe asthma, you may need higher drugs dosage or addition of additional drugs, and these will be talked later. So just to make an understanding about bronchodilation, I want to make a mention of something before I go there. Like every disease, asthma is divided into mild, moderate, and severe disease. The only difference is that in mild form of asthma, it could be mild persistent or mild intermittent. In mild intermittent form, where you get precipitating cause causing the asthma attack, one could consider using drugs as needed rather than doing it every day as a maintenance. I'm bringing in this word maintenance, so remember, Advair, Symbicort, Dulera, and Breo are all maintenance drugs. They are not to be used in an acute attack. They're not a rescue drug. They prevent an attack. In an acute attack, you have to use different drugs. So don't use them as needed. Don't use them for attack. Don't use them if you're having an acute attack. So that is the main thing. Now, I want to mention something about how these drugs act. Certainly everybody knows that steroids are anti-inflammatory. When you reduce the inflammation, the sensitivity of the bronchial tube decreases. And when the sensitivity is decreased and the edema or the swelling is decreased, you produce less mucus, less irritability, less cough, less bronchospasm, less response to any irritant like inhalation of pollen, dust, any chemicals, etc. The bronchodilators, which are adrenergic drugs, how do they work? So in our body, we have both types of chemicals working in an opposite direction. For example, insulin, which everybody knows, decreases the blood sugar. Glucagon, which is another hormone, increases the blood sugar. Similar thing is known to occur with every possible hormone or chemical in our body. So we have chemicals in our body, the sympathetic system. Stimulation of this system increases the blood pressure, increases the heart rate, increases the opening or aperture of the bronchial tubes or causes bronchodilators. So the drugs which are bronchodilators are adrenergic drugs. They stimulate formation of something like adrenaline. It is not adrenaline. They do not stimulate adrenaline as such, but the receptors that are there in the bronchial tube are stimulated, and that's how the bronchodilation occurs. So the effects or the side effects are similar. Bronchodilation occurs, but at the same time, one may have tachycardia, increased heart rate, increased blood pressure, palpitation, nervousness, shakes. So these are the common side effects of bronchodilator drugs, but they are essential mainstay along with the inhaled corticosteroids. So we'll talk about the additional drugs during my next video. Hopefully I'll do that soon on the asthma. Thank you for watching. I hope you are enjoying. Please subscribe and watch my videos. Have a nice day.